March of 2020. For many, they were the last few days of what we now consider normal. It's now been 2 years since life as we knew it changed forever.
This afternoon, we learned that 3 Ohioans have tested positive for COVID-19. Dr. Acton just signed a stay-at-home order for all Ohioans.
In less than an hour, the second stay-at-home order goes into effect here in Ohio.
People at home, you are moving mountains. You are saving lives.
Since March 9th, 2020, more than 2 million Ohioans have been infected with COVID-19. Over 37,000 have died. Here in Northeast Ohio, the Cleveland Clinic helped lead a nationwide response. I sat down with the clinic's CEO and chief medical officer to look back and reflect on 2 of the most difficult years in recent history and look ahead to where we go from here.
We were concerned about this new and emerging disease. We really didn't know how severe it is. What is the potential of this to develop further?
Cleveland Clinic CEO Dr. Tom Mihaljevic calls the COVID pandemic the greatest challenge of our lifetime. In January 2020, the clinic began activating its incident command group. But despite that preparation, Dr. Mihaljevic identified what he called 3 crises over the course of the pandemic.
The first crisis came in a form of a shortage of personal protective equipment for people who work in healthcare and generally.
The clinic's chief medical officer, Dr. Bob Wiley, in charge of the system's pandemic response, says a lot of PPE was made in China and nasal swabs were made in Italy. Both countries hit early and hard by the virus, leading to a shortage in supplies.
How much do we outsource PPE to other countries? How much needs to be internally produced in the United States to make sure that we have enough adequate supplies and redundancy in the system?
This really is the day we've been waiting for. It starts the process of the end.
The success story of the pandemic, the development of mRNA vaccines to fight COVID.
It truly is like the light at the end of the tunnel.
A powerful tool, but only if used.
There was a big disappointment about the fact that very many people did not want to take a vaccines that are both safe and effective.
So ideally, we would start even earlier to talk about vaccines, their safety and the possible problems associated with them, why you should get a vaccine. We need to be out in front in terms of the public messaging for this moving forward.
Then yet another hurdle as things were starting to look up.
1 in every 5 positive COVID-19 cases has proven to be the Delta variant.
Isabel Lawrence has more on what we can expect as Omicron sweeps across the state.
I wish we knew about the serial viruses coming out, the quote, the variants of concern, which it's not just one, alpha variant which hit us. It was Delta and then Omicron.
Over the last 2 years, the clinic has treated about 30,000 COVID patients in their hospitals, with the worst surge this winter.
We had 1,200 patients within the Cleveland Clinic hospitals in Northeast Ohio. At the same time, we had over 3,000 caregivers out. So that's a tough combination to manage at once.
Of those 1,200 patients, 20 to 25% were in the ICU. Through devastation and loss came innovation out of necessity and tools these doctors say we can use in the future.
Few people know that mRNA vaccines were actually been in development for quite some time, and they have been in development to treat different forms of cancers. So we're very fortunate to translate the knowledge that we applied for certain category of diseases into the knowledge that we could then apply for the more effective treatment of the pandemic.
It seems like there was a great amount of innovation in a relatively short amount of time to tackle this new challenge. Have we seen that in medical history before?
No, I think this is the first. One is technology is at the point where we can do it, but the second thing is the regulatory framework to allow us to do it.
With these tools and learnings, we are in a better position if there is a next time.
For future pandemics, we're going to be better prepared because we have this experience of dealing with unexpected threats of COVID pandemic.
And the doctors say there could be. Dr. Wiley warns of future possible variants. He's keeping his eye on the more contagious yet less severe BA.2 variant, already spreading in Europe and Asia. No matter what lies ahead, both doctors want one thing to stay the same: teamwork between health systems throughout Northeast Ohio and the country.
I think one of the most amazing things that I've seen is the cooperation between the state and the local healthcare systems and how we can come together to provide care between systems.
Banding together against a virus that changed all of our lives.
I believe that collaboration is not going to be just beneficial in a time of crisis caused by pandemic, but I think that we can do a lot of good through collaboration on other public health care issues that are equally important.
Yeah, it was fascinating picking their brains about everything happening over the last 2 years. And I also wanted to point out to Dr. Wiley, who we spoke with there, he actually became the zone leader for Northern Ohio, Zone 1, of what became Ohio's 3 hospital zones. So that was a huge job that involved coordinating with public health departments, hospital systems, and then actually watching hospital capacity to ensure that if anyone was becoming overwhelmed, they'd be able to kind of distribute patients. And he attributes that to being part of the success of the pandemic response, is being able to have those coordinating pieces. But so much going on there over the past 2 years, and it's amazing to think about how much we've learned and hopefully how far we have come.
Right, it's interesting to see, and I think you told that story so well in terms of what we've learned coming out of this and how we're better prepared to face, future, whether it be pandemics or just variants in this, with this COVID. But, just stepping back in time through all that, I remember at one point, the healthcare professionals were so overwhelmed and they were so burnt out. I mean, there were multiple points where that happened, but, I just have so much tremendous thanks towards them for what they have been through. We've all been through it, but boy, they just got hit the hardest with this. And I'm sure they're kind of breathing a sigh of relief, but, kind of tense about it in terms of where we go from here.
Right, yeah. Both of those men just so grateful for all the work of their healthcare systems and healthcare providers, just like we are too. So thank you to those healthcare heroes.
Absolutely.